The biopharmaceutical drug market is expanding at an unprecedented pace, fueled by groundbreaking innovations and the rapid adoption of new therapies. But with progress comes complexity, soaring costs, evolving regulations, and persistent access challenges. How is the industry adapting to navigate these hurdles? And what strategies are unlocking new opportunities for patients, providers, and innovators alike? I'm Michael Sarshad, your host, along with Sarah Rubin, for this special series of the Syneos Health podcast in collaboration with Asembia and the Specialty Pharmacy Summit. In conversation with key thought leaders and industry experts, we'll explore the dynamic forces shaping the market today. Tune in as we discover key strategies, industry trends, and collaborative innovations driving the future of market access and specialty pharmacy. Welcome to the Syneos Health podcast, Navigating Modern Market Access.
My name is Sarah Rubin, and I work at Syneos Health with an agency that is purely focused in on market access communications.
And my name is Michael Sarshad. I'm Managing Director for our commercial consulting organization.
And we're here today to talk a little bit about some of the key topics that are going to be discussed at Asembia 2025 in Las Vegas. Asembia, as you all know, is one of the biggest market access congresses every year. It holds a lot of different stakeholders within the market access realm, and it's an opportunity for all of us to get together and really discuss some key issues and topics within the market access space. So, Michael, tell us a little bit about some of the key topics like tariffs and potentially AI shaping access and patient services.
Tariffs is on everyone's mind right now. I'm afraid by the time this podcast is aired, this podcast might be tariffed as well. But really, pharma companies are thinking about it today, and they're trying to scenario plan, if you will. Okay, what's going to happen in the future? How can they prepare for tariffs? What are the downstream implications? Who's going to absorb these costs? Whether it's the distributors, specialty pharmacy, the manufacturers, the patient, right, insurers, all these different players are involved, and we're trying to figure out, all right, how are tariffs going to play a role here? And what pharma companies are really doing is, as I mentioned, they're scenario planning, and even the investors are scenario planning. So when they're thinking about new launches, upcoming relaunches, and drugs coming to the market, they're trying to think, okay, how can I mitigate tariffs and how can I plan for them so that my financial modeling and when I'm bringing this drug to market, it's not such a shock to me and the rest of the system? Who can be a partner in absorbing the tariff as needed? And what does that look like ultimately? That's a key trend that everybody's thinking about. The other one, which you touched on, Sarah, as well, it's AI. Everyone is talking about AI. AI this, AI that. Again, AI is something that we've been doing in the industry for quite some time. But the difference today is the computing power is evolving. So it enables us to look at data faster, larger quantities, and with greater accuracy. And AI is really helping us move the needle when it comes to understanding what patients need, looking at patient services, support services a little bit differently, right? We're taking complex information from tons and tons of patients and trying to utilize these algorithms to understand, okay, what is it that this patient really needs? How can we treat their desires a little bit better? And how can we formulate our offerings to be more customized to what they need? Same on the payer side with insurers and also physicians. We're trying to understand how can we utilize AI in particular to make our model streamlined and more effective. I'll give you an example. We could say, okay, payers could utilize AI when it comes to pre-auths and pre-approvals. They could just utilize it in an AI algorithm to review the document and say, hey, we believe that this has what we need to move forward in the pre-auth process. Or it could be an immediate red flag. Send it back to the physician. Say, hey, actually, you're missing X, Y, or Z, automate it, and it just speeds up the process rather than a physician sending something in. They have to wait for a review, then they send it back, and this back and forth is no longer needed anymore. Another big one, value-based contracts, value-based agreements. Why do payers hate them? Because it takes so long to evaluate all the different factors in it, and they got to keep track of this, keep track of that, and all these different risk factors that are involved in it. Well, now with AI, you can utilize machine learning to evaluate all these different factors at a much, much faster pace that enables a value-based contract to be more feasible when it comes to implementation. So all these things are really changing today's pace and scale. Sarah, tell me a little bit more from your perspective. IRA is a huge topic, top of mind for everybody. What are some of the positives and maybe not so positive aspects of the IRA?
Yeah, Michael, good question. The IRA still remains top of mind, even though it was the Inflation Reduction Act of 2022, and now we're in 2025. Obviously, the IRA didn't really fully get implemented until last year. And I remember being at Asembia last year, and the IRA was the topic of many of the sessions. And this year, it does remain a topic of a few of the sessions also. And it does continue to be on the minds of our pharma manufacturer partners as well as payers. And as you mentioned, there are a lot of positives that go along with the IRA, but there are some challenges that we've seen and our pharma clients have also seen. A couple of the positive aspects of the IRA, particularly patients, are the $2,000 cap for Medicare Part D enrollees and the Medicare prescription payment plan that allows the enrollees to opt in if they want to spread their deductible over that plan year. So both of those aspects do help Medicare enrollees, Part D enrollees, from a financial perspective. But because the costs of that have to be offset from a payer standpoint and from a manufacturer standpoint, there are some challenges to the IRA. One of the challenges is that the IRA has kind of created an increase in payer utilization management because, again, the payers do need to offset some of the costs that now they're having to absorb because of the IRA, because of the $2,000 cap. So the increase in payer utilization does put a burden on the HCP offices. So Michael just mentioned prior authorizations and all of those other types of utilization management. That does put a burden on their office to help a patient get through those hurdles. And of course, it does affect the patients as well. An increase in utilization management can lead to delays on patients receiving their medications. So the time it takes from HCP writing the script until the patient has their product in hand, that could increase. And then potentially an increase in patient out-of-pocket costs as well.
Another thing that's top of mind for our listeners, do you anticipate changes coming to IRA with the current administration?
Yeah, that's a good question. And I don't 100% have an answer to that. It will be interesting to see what happens. Obviously, as you know, the Inflation Reduction Act had been talked about for a long time. The whole idea of Medicare price negotiation had been rumored for probably over a decade. And finally, in 2022, the legislation was passed, and it is taking even several more years to get to the place where that negotiation is happening, which is right now. It's happening right now. I don't see that the price negotiation probably will go away. And I don't think it's been a hot topic of the administration as of yet. But again, we don't know. And I know that the effects of the new administration, that is one of the sessions at Asembia, and I will definitely be there to listen, to hear what other people are thinking about, will the administration change anything around the IRA? But that price negotiation, that's another potential challenge, especially for the pharmaceutical manufacturers. And as you know, the second round of drugs was announced earlier this year, and those manufacturers are preparing themselves for those negotiations and then once in the future. So those are definitely top of mind for manufacturers to navigate through some of those negotiations. Another key trend that we've been seeing with population health decision makers came through our survey. So we just received the results of our 5th annual Spirico Population Health Decision Maker Survey. And in that survey, we saw that digital resources are in high demand. With population health decision makers, there are specific websites, as well as platforms like ICER, AMCP, news feeds, social media, all of that playing a bigger role in order to reach our population health decision maker customers. And as you know, obviously our pharma manufacturer clients do want to be able to reach these PHDMs with their value messages and other communications. And what we're really seeing is these PHDMs are going digital. LinkedIn still remains the primary professional platform. So all of that means that manufacturers should really focus in on having a strong presence digitally, as well as through other platforms, third-party platforms, again, like ICER and AMCP and Asembia. We also saw that PHDMs prefer kind of a mix of touch points. So they still appreciate in-person meetings with their account managers and other people from the pharma companies. Virtual meetings are still key. So even after COVID is over, those virtual meetings are still important to population health decision makers. They still enjoy receiving emails. I guess they do read them. They're telling us that they read their emails, as well as like web portals that are designed specifically for their needs. And also what we're seeing is that PHDMs are really still focused in on clinical differentiation and real world evidence. And they would like to spend the majority of the time talking to their manufacturer partners on evidence and not as much on contracting. And then the top 3 issues that are top of mind for these population health decision makers are legislation and regulatory changes. So just discuss the IRA. That's one of those changes and regulations that are top of mind for PHDMs. Cost management and drug pricing controls. So again, a little bit around price negotiation and other aspects of the controls that are brought to them and to manufacturers by the government. And then biosimilars and specialty pharmacy. They are very interested in what is happening within the biosimilar space and then also what's happening within the specialty pharmacy space. So we're ending on a perfect point right there, because Asembia is the place for our population health decision makers, as well as our manufacturer customers, to meet with specialty pharmacy and to all gather together and really discuss some of those trends and come up with solutions and ideas around those trends in the marketplace.
All right, everyone, we're looking forward to seeing you on the floor at Asembia. Please feel free to come visit us at the exhibit hall. We'll be doing podcasts all conference long, booth number 2016, and looking forward to another great year and another great conference. That's all for today's episode of the Syneos Health Podcast, Navigating Modern Market Access. I'm your host, Michael Sarshad. If you have any other topical issues you'd like to hear on this podcast, please send us a message at podcast@syneoshealth.com. For access to more future-focused, actionable life science insights, please visit the Syneos Health Insights Hub at insightshub.health.